Hello, everyone. This video is brought to you by Minnesota Aging Pathways, formerly known as the Senior Linkage Line. Now, what do we do if we want to compare these or to get a closer look at the plans? So we're going to scroll back up, and so here's our first plan. So here is plan details, and if we click into plan details, this will give us the full details for this plan. Again, we have the ID, we have a link here to the plan website itself, we have a phone number for non-members, and we have a phone number for members. So if you were a member of this plan already and had coverage questions, you could contact them here. Or if you're a non-member interested in this plan, you could contact them here. So what you'll pay, it breaks it down pretty quick. And an important thing to notice right away if we're doing medications is covers 6 out of 6 drugs. That's a good sign. If it said that it only covered 5 of the 6 drugs, we'd have an issue where that medication we'd be paying full cost for. So as you scroll down through this plan, you could also click on the tabs to scroll down faster. But let's just take a leisurely scroll through this plan. So here's the overview, again, talking about the premiums, reminders about the Part B monthly premium, and then we get into the deductibles, and it reminds us what this is, the amount you must pay. We get the max cost, plan contact information. And as I scroll down, you can see that this tab switches over to benefits and costs as we get to benefits and costs. And doctor services. This is where you could view your provider network directory. This is very important for an individual to do. This is how you know if this plan is going to work with your doctors. If you want to keep your current network, that should be a starting point for you. We'll also see some basic estimated costs here. Doctor visits, specialist visits. If it's in network, here's the copay amount. Test lab and imaging. Maybe you have a high need for MRIs or lab services. These numbers could be very important to you. Inpatient hospital, skilled nursing facility, preventative services, ambulance. There's also this blue bar here, view more benefits and costs. This just pulls up more stuff. So in case you needed information on these items, that would be there. And as we continue down, we get to drug coverage. Friendly reminder, if you wanted to check out to see if there was ways to help lower the cost, you could click and follow into there. Here we see our drug list. Again, we could make changes if we needed to. We see the name of the drug, the quantity, frequency, and here we see whether it's brand or generic. We scroll down here and now we see our pharmacies that we selected. Walgreens, in-network, green with a check mark. This means that this plan will work with this pharmacy. We see the same for Cub, we see the same for Essentia, and we see that this CVS pharmacy is out of network. So that one, we would pay retail cost at. Again, this would help us find a pharmacy that is in network for this plan. And then down here, we see preferred. So you could be out of network, in network, or preferred in network. Preferred in network is typically going to be the lowest cost option. But as we can see, these ones are also in network and would work with this plan. And here it breaks it down further as far as how much each medication would cost at these locations. And just at a quick glance, we can see that these ones are in the hundreds and this one goes up into the thousands. And that's because it is an out-of-network pharmacy. Here we see information on the Medicare prescription payment plan. Click here to learn more about this and see what your drug cost could look with this option. We want to look at this option if it is important or needed for your individual drug costs. And here we'll see the estimated total drug cost and premium, when you would meet your deductible, if you wouldn't meet your deductible. And here it notes that you wouldn't meet your deductible, and that's because they have to be at a pharmacy that's in network. Otherwise, your costs don't count towards the deductible. And here we'll even break it down by month. And we see that for mail order pharmacy, it's not showing every month. And that's because mail order typically does a bulk order of 3 months at a time, which is part of the savings for this option. Again, out of network, we're seeing retail costs. And if we wanted to, you could click individually into here to see what the drug cost would be during the coverage phases. Retail cost before deductible, after, once you meet the cap. You can see the amounts change as you go through the coverage phases. I'll click the minus here to close that out, but we could do that for each one of these. Again, we have a blue bar here with view more drug coverage. And this allows us to look if there was a difference between generic, preferred brand, non-preferred drug, specialty tier. And here we see what tiers the medications are on, if they require a authorization, if they have quantity limits, if it requires step therapy. These are all things that are important to know about your medications and that you can discuss with your medical provider. A little bit of information on Part B drugs.